The first thing that is important when we are evaluating patients for implants and the potential for immediate implants and loading is who are the best candidates for this, when can we do these procedures, and how are they executed. So we have 4 patients on the screen here, and all these patients probably present with different risk factors associated with doing immediacy, and some of them would be good candidates to proceed with that process, and some would not. So when we think about streamlining patient care, a lot of it's tied to accelerated treatment protocols. We want to, in patients that are good candidates, embrace those procedures that lean towards immediacy. And in patients that are not good candidates, and you understand the risk factors, move away from that and go with a more structured approach. So when we think about accelerated treatment protocols, we want to have minimal trauma to the area. We want to make sure that we have a bony housing to get primary stability of the implant, and in all cases have a facial plate that's present that allows us to house the implant within a horizontal defect dimension that can be grafted. Now, I would say just off the bat, we're more of a conservative practice here, and I'll show you the statistics on how many immediate implants we do. But the Osstell ISQ device is very functional in this patient base. Where are the advantages to this? Well, we have decreased treatment time for patients, decreased trauma for our patients, which then I think leads to better response from the tissues. And patients are much more appreciative when they can have a tooth in place or they can get to a tooth faster. But it's up to the clinician to identify these patients and if they're good candidates for this type of treatment protocol.